welcome to this week's episode of Ask Dr. Jessica. Today we have a very special guest, Naama Cameron.
Hi, everybody. Hi.
Naama is a parent coach, and she works as a behavioral specialist. So I'm really excited to talk with her, pick her brain, and discuss a lot of the behavioral concerns that I hear from parents. So Naama, maybe we can start with, tell us how you got into this field. How did you become a behavioral specialist?
So I worked as a school psychologist and didn't really feel like that was my niche because I didn't get to do as much hands-on with the kids as I wanted to. And then I went into teaching, and my final year of teaching, I spent so much time helping parents set up good systems in their home that I thought I should go and do this. And I just started my own practice, and organically, as the time went on, I started specializing in certain things, and one of those things is withholding. It's one of my areas of expertise.
Can you explain, so what is withholding exactly when you say withholding?
So withholding is kids that, whether they withhold their poop, they won't go in the toilet, maybe they'll hold it all day, they won't go at school. It could be poop, it could be pee. They can go every day, but they're having accidents. They can go every couple days. It's such a spectrum of what that looks like, but essentially it's just not going regularly in the toilet consistently.
Okay, and did you notice when you were working with families that this became a common theme? Is this how you gravitated towards withholding?
Absolutely, and I will tell you, since COVID hit, before COVID, it was probably about 60% of what I was doing, was kids withholding, where now it's about 90%.
Wow,
oh,
90%?
Yeah. 90%.
Wow. That's interesting because sort of, as I think about it, when I talk to families where kids have issues with going to the bathroom, sometimes I wonder if it has to do with school, whether or not they're afraid to use the restroom at school, or they, maybe they're embarrassed to ask the teacher and they don't want to ask permission to go to the bathroom. So it's interesting that during a year where they're home more, you've noticed more issues.
And, I think it could be parents are a lot, because the parents are with their kids so much that they see it a lot more. They're way more affected. I also, as expected, parents really laxed on the boundaries and the rules and let kids do a lot more than we would have before. And I think that, and we'll talk more about that, but when those lines get blurred and kids feel like they have to control more, that's where you see the withholding come out more.
Interesting. Okay. Now sort of backing it up, when I think about little kids, we're expecting that they're going to have problems with the restroom, or they're learning how to use the restroom. It's a process. So when you talk to families, is there a certain age where you tell them this is normal? At what point does it become something where they should reach out to someone like you, a behavioral specialist?
So usually I would say around 3.5. And I'll tell you the two common threads that I see with these children. There's usually something, and I'm going to say traumatic very delicately, that happens for these kids. Maybe they didn't go for a couple days and then they had a really big poop, and then that stopped them from wanting to go and then starting to hold it. And then that pattern getting reinforced and continuing. Another trigger that I see very common is that parents will say, okay, well, I'm just going to wait until my child's ready. And if there's no healthy encouragement and a certain kind of personality mixed with that, you're going to have a child that's just, you're going to wait until 5.5, and then the parent says, well, they don't want to go, they're refusing to go, or they'll only go in a pull-up.
Interesting. Okay, so more it becomes a pattern or something that they're used to.
Yes. Okay,
so just for parents listening out there, can you talk about, and I can chime in too with this, but when is what's the range of potty training? For example, for peeing, for pooping, for girls, for boys, what's sort of the normal range that you expect to see?
So, and this was even with my own children, from about 18 months till I would say by 3. My son was potty trained by 18 months, and that was just because I was very in tune with his cues. And
Okay.
I didn't force, but I also encouraged, and I was very mindful of not making it a power struggle. And what happens is a lot of times is withholding is connected to a power struggle. And it's something that we as parents really can't control. We cannot control our kids' bowel movements. And they can. And so the more that you have that battle, the more that the kids continue to withhold. So I was very mindful as soon as I saw that my son was interested. He knew when he could feel it in his diaper. I also helped him be very independent in the process. I gave him a lot of control about it and really minimized the pressure, but a lot of encouragement. So I would say between 18 months to 3 years old is that window. If you miss that window, like I said, that's when you have a lot more challenges and you have a lot, that power struggle and the withholding.
Okay. All right. So just just to tell parents how I present potty training, I usually see females on average. They're trained with urinating usually around 2 years, 3 months, 2.5, sometimes closer to 3, and the boys tend to be a little later. Oftentimes 2.5 towards even 3 years old, and for stooling or for pooping, it tends to be closer to 3, and if not beyond. And I was always taught that before 2, it's really tricky to potty train because kids can get mixed messages. So that's interesting to hear that you had success at 18 months. Sometimes parents will tell me these stories that they're trying to potty train when their child's 9 months old, a year, and they'll put them over the toilet. And I feel like that's definitely too young.
It's young, but kids are very smart and very aware and very in tune. And
yes.
I feel like sometimes we don't give them the amount of credit that they really deserve. And like I said, if you're just very in tune with your child and you can see,
Right.
my daughter was it took her a little bit longer than my son, ironically, but I could tell that he was uncomfortable as soon as he had pee in his diaper. I could tell that he was interested in the toilet. We would go sit in the toilet and it was very fun and it was more
Right.
curious. And then organically, I followed that. Unfortunately, what happens is parents tend to back off that and they don't follow that, or they put too much pressure, then that's when you get the issues.
Okay, so your overall message to begin with for parents is that follow your child's cues without
Absolutely.
pressure, but if they lead you, follow those cues.
Absolutely. Have a little toilet out so they can go sit on it. They can discover it. I had one since they were babies. They were just always looking at it and playing with it, and it was just there. Oh, do you want to sit on it? Do you want to try? No pressure, nothing.
Okay. Yeah, no pressure. Keep it light and easy. Available if they want it.
Exactly.
Okay. So if you were to give a parent a message about how to begin to make their children feel comfortable with the potty, do you have any other tips in terms of, in addition to providing a potty for them to sit on, anything else that would help?
Books.
You mentioned less pressure. Books. Okay, good idea.
And role modeling. Not making the bathroom such a big deal. I always went to the bathroom, letting my kids see me, it being very normal. Kids are curious. And the more that they know about things, the more comfortable they are. So model it. Now, I'm sure we'll talk about this later, but we do have to model it appropriately. And we talked about having the little potties available. But oftentimes what I see with my families is that those little potties are all over the house. And they're in the living room and they're in the kids' playroom. And that's not what we want. We want to really set the tone that all this toileting stuff that goes on in the bathroom. Not anywhere around the house, but it goes in the bathroom.
Okay. All right. So that's smart, so that they know specifically this is where toilet training happens or where potting happens. That makes sense.
Because later down the line, what happens is my families will say to me, oh, well, we let them use the toilet in the living room, or we let them use, and so what you're doing is you're allowing them to be sort of lazy with that potty training, and that's not what we want to do.
Okay. All right, so let's talk about that first situation you were describing where a child has a bad experience, they wait a couple of days and they go to the bathroom. How would you advise a family like this? So if you notice that a child starts to go less frequently and it's painful when they do go to the bathroom and that's causing them to hold in, how would you guide a family in this situation?
So usually at that point, they will go see their GI just to make sure that everything is moving okay and they're not backed up too much. And at that point, the GI will recommend, a stool softener, maybe Miralax, and that will help the system go. So you're taking care of the physiological part of it. The important part that my focus is on is the emotional part, and that's not making it such a big deal, not discussing it so much, not bribing your child over and over again about this. I'll give you this, I'll give you this. And as soon as you give it attention and power, then you're you're reinforcing that pattern of the child withholding.
Okay. So what you notice is that, I would think that a lot of children, so the way I understand it is that we can cause a vicious cycle where if kids, oftentimes we'll see constipation around potty training. And if they have a bad experience, it's painful to go. When they have an urge to go poop or to use the restroom, they'll sort of squeeze and clench and hold in, and eventually that urge will pass. And then when they finally have enough stool and they have to go, it does hurt. So it becomes this cycle. So what I think what you're saying is interesting. I thought they were holding in more based on fear of pain, but you're saying it can turn into a form of control in some circumstances?
100%. 100%. And then what happens is when they are crossing their legs or they're, rolling around trying to hold in their poop, parents have a big reaction. And what happens is it's so emotionally triggering. And I understand. I mean, I know withholding brings so many emotions for parents. And, I always like to say parents are not alone because so many parents do experience this, and there is guilt and there is shame and there's so many emotions as a parent that we feel when we see our kids doing this. So I think those emotions get put on to the child, and you kind of feel this desperate, like, I need you to go, and all this pressure and discussion. And oftentimes what happens is that child who's withholding becomes the center of the entire family. So all of this attention is given to this child who is withholding, who's rolling on the rug, who's uncomfortable, crying in pain, and parents are essentially begging their child to go to the bathroom. And that pattern is reinforcing that negative behavior.
That's so interesting. So at some point it can mix. It can turn from being constipation and blend with some attention-seeking behaviors.
And it works because parents are so triggered by it.
Right.
And, as soon as, and I will tell you, 9 out of 10 times these kids have strong personalities. And they've got a strong will and they know what they want. And it goes hand in hand. I see it oftentimes. And so there has to be a healthy balance of the amount of control that these kids have compared to running the show.
So what should a parent do then if they're, it makes sense, for health reasons, we want to see kids go to the bathroom. How should a parent approach this if, giving them attention for it isn't going to help matters? Should they ignore their children? What's the right message we should be giving to parents?
So there's steps to making children who withhold or they poop in a pull-up. There's steps to have them take more responsibility for that, where it's not so much a power struggle. And what that would look like is, having kids be a part of the changing process. I tell parents all kids should be changed in the bathroom at that point. We're not talking about a 9-month-old. We're talking about a 3.5, a 4.5, a 5.5-year-old. They should be changed in the bathroom. Oftentimes I have, 5.5-year-olds that are being changed on a changing pad. And the message that we're saying is we want you to act like a big boy or a big girl, but we're not going to treat you like one. We're still going to. So it's about having them be independent, be a part of that changing process, and also not giving it attention. So an example is if a child is laying on the ground and holding their stomach and crying, I would say, oh, you know what to do if you want to make yourself feel better. And then put it on them.
So you're empowering the child.
Exactly. And letting them know this is your decision. This is your control.
Okay. Now, what about, this is a question that comes up all the time. There's a lot of kids that, they'll learn how to urinate or pee on their, in the toilet, but pooping comes later. And one example I hear often is that children will ask to poop in their pull-up. They refuse to go on the potty. They want to go, they'll hide in a corner and they'll go in their pull-up. And parents don't know what to do in that situation. What do you advise families when their children refuse to go in the toilet and they know they're capable of, sensing when they have to go to the bathroom and they want to be in a pull-up? Do you think we should just let kids continue on that way, or what should parents do?
Great question. So, and this is the first step in really helping kids be more comfortable going in the toilet. I say put the pull-ups in the bathroom. When your child has to go, they go in the bathroom independently, so they're not getting one-on-one attention from the parent. They go in the bathroom, they put their pull-up on, they poop, and then they call you in, and they are doing most of the changing. Obviously, whatever we have to do to make sure that they're clean, but they need to be the ones taking off their pants, helping with a pull-up, throwing it out, wiping. They need to be a part of that process. And I tell parents during that changing time, limit the amount of discussion, because it turns into one-on-one time. The parent is in the bathroom with the child, even though it may be negative, and to a parent it's like, why would this be reinforcing to my child? But it is, because you're not working, you're not with the other kids, you're giving your child undivided attention. That's what they see, and that's what you want to avoid when it comes to this.
That makes sense, because I know psychology really it plays a big role with children, and I know that they'll do anything for attention, be it negative or positive. They just like, they want their parents' resources. They want our attention. So that makes sense to me.
Absolutely. That's so much of it. And again, like I said, by the time these parents call me, it's like they'll say to me the whole weekend revolves around this child and their bathroom. And we can't go anywhere. And they dictate where we go. And there's so much control and attention around it that It's just reinforcing that child. And let me tell you something. Usually by 2.5 or 3, these kids know the signals. You could tell they're touching their pull-up. You could tell they're saying pee-pee, or they're communicating that they want to be changed. I would tell you, I've never, and knock on wood, I've never had a child who it has been anything other than behavior. It's never been anything more. It has always been behavior, control, and the second we change it and we change the dynamic between the parents and the control, they're done.
Interesting. So you were saying initially you send them to the GI to make sure it's not physiologic.
Always.
Usually that's not the answer,
generally
speaking.
And I've had parents to do tests and tests and tests, and I always say, it's behavior, and they'll come back and say, okay, it is behavior. So if a child is showing signs, there's nothing wrong with not pressure, but a good amount of encouragement. Okay, well, we're going to take the pull-up off, or maybe you do it gradually. Maybe you do it for a couple hours, and you're monitoring, and you're taking them to the bathroom. You can use some sort of reinforcement. This is a time when it comes to toilet training that I'm like, okay, if you use, an M&M, a Hershey Kiss, whatever it is to get your kids comfortable, because it almost is like a desperate measure for parents. If you miss that window, it's really tough, and it's hard to backpedal and fix that up. So I always say, start if you can, and if you miss the window, you've just got to make sure that you're not reinforcing that pattern.
So just to make it clear for parents listening, because I do think there's a time that's too soon, and I think there's a window that's too late. What should parents look for? When is that proper window?
So like I said, if they want to be changed, if you could tell that they're uncomfortable, they're showing you that they're uncomfortable because they're wet, or they went to the bathroom, they're touching it, they're curious, they're putting on their own pull-up. These are little cues that say, okay, my child's interested, and let me go with it.
What I'll usually tell parents is it's too soon to start if they're not bothered by being in a poopy diaper. that once they care that they're sitting in poop and they don't like it, that's a really good time to initiate potty training.
So I think that works in some cases, but what happens is parents will call me and they'll say, my 5-year-old, my 6-year-old will poop in his pants and he doesn't care.
Okay.
And so, I say to them, that is not unusual. Some kids, yes, it'll bother them. That's how my son got trained. He could not stand the feeling, and so he was like ready to go. But some kids are okay with it. Some kids could sit in it. Maybe they want to play. They don't want to stop playing. The sensation doesn't really bother them. They're not paying attention to it. So it's like a 50-50 with that.
Okay. And a lot of parents have different methods in terms of potty training. I hear about the 3-day boot camp and the no diapers all weekend method, and gently encouraging them. Do you have a preferred method for potty training, or?
I think it just depends on the child, honestly.
Yes.
There are some kids, and that's what I think also is confusing for parents, is one sibling can follow the 3 days pantless and they're fine. And then they try that with their other child and they're just like, it didn't work. Like all hell breaks loose. It didn't work. So it really depends on the child. I think, the ones with a stronger personality are the ones that have some sort of traumatic event with a stool that, they get constipated. It's a different approach. And that it's not going to be a 3-day, that's it, we're one and done. It's more of a gradual, let's make this process inconvenient organically. You're going to have to be more independent in this process. You're going to have to go get your pull-up. You're going to have to change your pants. Give them more of that. So to a child, it's like, oh, I'd rather just go in the toilet than do all of this extra work on my own.
These families that you see and that you've worked with, where withholding is an issue, do you notice a common thread in terms of the dynamic between the parent and the child, or the personality types between the parent and the child?
Most of the time and I love these kids because they're smart, they're savvy, but it's your strong personalities. It's the ones that like their way, the ones that, will argue, will power struggle, they run the show, they, have tantrums. I see a lot of the same themes, and that's why I always tell parents the bathroom and the withholding is just one aspect of it. If you target the entire behavior, then it's easier to manage the bathroom. And that's what I really encourage my families is set up some boundaries, have some clear structure around the house, be consistent. That will help your child not need to feel like they've got to control.
Do you have any general advice for parents to deal with kids like this? Anything else that we didn't talk about?
Take a breath, because it will get resolved. I just, it breaks my heart because by the time parents come to me, they're broken, they're overwhelmed, they're so stressed, they're so drained, and it becomes their dynamic. It becomes their relationship with their child. So if I could just say to you, take a breath, step out of it, try not to give it so much power and act more matter of fact about it and put it more on your child, that's the best advice I can give.
That's great advice. I know we always say, by the time they're walking down the aisle, they'll be out of diapers.
And it's true, but I think in the moment it's so triggering for parents, and parents have tried everything. They punish, and I will tell you this, I do not recommend ever, ever, ever punishing your child for withholding or having an accident. The amount of shame that comes with that, and it has never, ever helped a child go to the bathroom. It does not. So I don't recommend that at all.
It's hard, though, because I think in the moment, for a lot of parents, it makes sense. Pooping isn't in public, it's not fun, or if you have to change the sheets in the middle of the night, or it's messy. So I think it's hard for parents not to hide, not to hide their emotion that they're not totally thrilled with the behavior.
And I think in those moments, too, they're just like, what are you doing? And you know better. And that whole conversation does nothing. But if you put it on them and say, well, if you don't like doing this, it's up to you. You can make that change. It's more about empowering your child and not making it a power struggle or about you and your emotions.
Okay. And what's your experience like? How long does it usually take kids to to improve with this behavior?
So
I'm sure there's a range, but what can parents expect?
it varies. I will tell you, I have been very successful with this. I have a whole little thing I do with kids, this whole little program, but usually it's pretty fast. Now, once in a while, I do have to go in the home and help, but what helps this process go much faster is having the parents there do their part. And for the parents to really set up a healthy family dynamic with some clear boundaries, some clear rules, and there is a separation of parents and child, so the child feels like, oh, I get to just be a kid. I don't have to be in control of everything or be in charge. That helps the process much faster, and the parents not giving so much attention. I can't tell you what a big part that plays in all of this. Now, I would say that's probably the biggest takeaway. Parents don't give withholding attention. Don't give it power. Act very matter of fact.
I think that's really good advice, but I also feel for parents because sometimes they'll tell me it's been hours, or their child hasn't gone and it's been days, and it's very distressing.
Very. I mean, my heart breaks when parents call me because I know where they are emotionally. And again, in our head, it's like, why would our child want to suffer? Why would they hold it in for so many days? Or they worry about, the long-term ramifications that this may have. But we still have to put all of that aside in front of our kids. As hard as it is, and I say, go in the room and complain to your significant other, but don't let your child know that you care.
Okay, so less negative attention and try to bring on more positive attention, it sounds like.
And for that bathroom is just really unemotional, really matter of fact. Like, oh, okay, we need to go change, let's go. And also, part of it is to really encourage your children to be independent and know what they really can do. I have a lot of parents, when I say to their 3.5-year-old, oh, are they getting themselves dressed? They're like, no, I don't think they can. But they can. And the more that we encourage our kids to be independent and build that confidence, the more they're going to want to make independent choices, like going to the bathroom on their own.
It's so true. I think I'm always surprised what my kids are capable of doing. If I let them pick out their clothes and get dressed and put their dish in the sink and use the restroom and brush their teeth, there's so much that they're capable of. But I know if I do hold their hand and get them dressed and put their shoes on, they're happy to take my assistance.
Of course they are.
But you're right.
And parent, I mean, you're right, you're spot on. We're always surprised at how much our kids can really do. And that's why it's so important to give them the opportunity. And even if they fail and they get up, it's a great learning lesson.
Right. So let's say, so I'm a kid and I'm withholding and I'm withholding my poop and I haven't gone in a couple of days. A parent puts a pull-up in the bathroom and a potty in the bathroom, and what should a parent do next?
So
what's the next step?
Let's say you're 3.5, 4,
yes,
even 5, even 6. Okay, so at that point, the little potty's out. Okay, because the expectation is, again, we're asking you to do big girl things like go poop on the toilet. So we want you to go on a regular toilet. I'm going to also tell you another trick I've learned. These little potties, kids can sit on for hours and never go. If a kid is sitting on a big toilet, it's a lot harder for them to hold in their poop. So the longer they sit and the more that they're on a regular toilet, the more likely they are going to go. Now, I would say to you, you can make a choice. You can either go in the toilet or you can go get a pull-up and go in the bathroom. When you're done, let me know. And let this be an independent process. I have seen many times kids organically just start using the toilet. Because again, it's like, oh, you have the choice. You can either go in the toilet or you can go in the pull-up, but you're by yourself and you're doing this on your own. And I think that's an important message to send to kids. And kids are very smart. They know, they see what their friends are doing. They will want to do organically what their friends are doing. They will want to organically do what's easier, and that's to go in the toilet. And then when they're done, they are really doing most of the work. You may be in there just to make sure that they're clean.
It's great. I know it is interesting how how many people out there are hyper-focused on their children's peeing and pooping habits.
I mean, I have gotten logs. I mean, it's so funny because it's just, we've talked about everything about poop, and parents are always uncomfortable first, and I'm like, I've heard it all. I know size, color, texture, all of it. Nothing phases me. It's like a normal conversation. And
everybody poops.
Everybody poops. Everybody poops.
All right. So I like this. So the big picture here is to encourage them, empower them to do it independently, but to try not to make it a big deal. So
Absolutely.
put less attention over their pooping and peeing habits.
Very matter of fact, very unemotional.
Is there any advice that you can offer to parents that we haven't covered yet? Any last thoughts for families if they're going through this?
I feel like the main thing is to really set up your house with boundaries and rules so parents are in control and that the kids feel like their parents follow through with their word, so that kids can just be kids and not feel like they have to control everything. And again, just be unemotional. Don't power struggle with your kids. And again, have expectations that you go to the bathroom in the bathroom.
Sounds great. I like the advice.
And you will get through this. You will get through this, parents, I promise you.
Thank you so much.
Thank you very much.